So good morning all. Today I'll be teaching you the second part of this pharmacodynamics, that is dose response curve. So in the last class we have found out that there are so many receptors on which the drugs act. We started with the G protein coupled receptor and what are the different types of receptor there. That is ligand gated receptors, voltage gated receptors, then we have studied something about the secondary messages which are involved, that is cyclic AMP, IPP-DAG pathways, and there are some secondary and tertiary messengers such as calcium. So with this, we are actually dealing with pharmacodynamic, that means what the drug does to the body. So once this receptor has been bound, there will be sequential changes which will be taking place by the way of secondary or tertiary messengers. Once this secondary, tertiary, and messengers are doing their job, we have seen that there can be changes brought about in the protein synthesis which is occurring, phosphorylation process which is occurring, or the changes in the mRNA synthesis. All these things are taking place and they are bringing about the response. Now, how do we measure this response? Okay, so this response can be measured by the way of dose response curves or the bioassays. Okay, so today we are dealing with what the drug does to the body, and we have found out that once the receptors are bound by this drug and how the responses are occurring, and we need to measure these responses, and how we are measuring these responses, that is by way of bioassay. And measurement of such responses is very important to understand how much the drug is effective. Okay, so the effectiveness of the drug is mainly defined by potency and efficacy of the drug. So today we are dealing with the concept of dose response curve and various types of response measuring activity. So good morning all. We'll be dealing with. So why we have kept on the top slide these rabbits and frogs eat? Because we are not directly going to measure the responses in human beings. Okay, so first we are mainly going to isolated tissues. That means the tissues which are extracted from the animals and also intact animals. So what we call it as in vivo experiments and in vitro experiments. So in vivo and in vitro experiments were were important part of this pharmacology experiments. Your seniors did. By now, what we are doing is we are not able to demonstrate this because of the data and all. So this will be theoretical part for you because you will be no longer seeing these responses in your labs. But you can see the videos of which are available on the YouTube and all. But theoretically, we'll be explaining the graphs which have already been taken out of these experiments. So how do we do this bioassay of the drugs? Okay, so this bioassay of the drugs is done with various methods. Okay, bioassay, understand the term bioassay. It is measurement of the biological responses of the isolated tissue or an intact animal for the medicines or the drugs. Okay, so how we do? We do qualitative and quantitative estimation of the drugs. Okay, so it is not the direct estimation of the drugs amount, it is estimation of the responses which we are taking. Okay, so that can be in the form of quantitative estimation of the drugs, biological methods, physicochemical methods, that is chromatographic, spectrophotometric, fluorometric, and mass spectrometric techniques. Okay, so radioimmunological methods and microbiological methods. So there are various scientific methods by which we are assaying this responses. Okay, but today we will be understanding the basic methods how we can do this. Okay, so bioassay is the means for measurement of the concentration or potency of a drug from a magnitude of its biological effect. That means how much the response is produced, that much is the magnitude of the response. Like that. Bioassay involves comparison of main pharmacological responses of unknown preparations with that of a standard. For example, we all know paracetamol is a drug to decrease the fever. Okay, so now paracetamol becomes the gold standard. And for example, all of you who are belonging to second year are ideally weighing between 50 to 60 kgs, and the ideal drug dosage for paracetamol for your age and for your weight will be around 500 milligram. But tomorrow we find that paracetamol has some adverse effects, and we need to use a drug which is of lesser quantity and more effective. For example, now we are using 500 milligram tablet. Tomorrow we should find a drug which is just 5 milligram of drug which will be effective to reduce the fever in all such patients. Okay, so that will be more effective and that will be more efficacious, because the drug, as it is amount is less, it may be less toxic to the body also. Okay, so with that note, we'll be studying this. Okay, so here bioassay involves comparison of the main pharmacological responses of unknown preparations with that of standard. Okay, so we have two types of responses: basic responses. We have other many types also, but the basic responses what we are dealing with today will be quantal and graded dose responses. Okay, so the dose response relationship describe the effect on the organism caused by different level of exposure. So dose response relationships describe the effect on organism caused by different level of exposure. That means we slowly increase the dose. That is like a arithmetic progression, like 2, 4, 6, 8, 10, like that. Otherwise, we can take it in a geometrical progression. That is 2, 4, 8, 16, like that. Okay, so that's how we determine the responses. So dose levels are usually expressed by milligram per kg, because these are the smaller animals, okay, rat or the mice which we are using, the smaller animals, and we need to find the ideal dosage so that the animal will not die in our experiments. And these levels can be plotted on a graph against the response. Okay, so for example, we are taking 5 milligram in the initial part, later we will take a 50 milligram, like that. But it is very difficult to plot such responses. We what we try to do is we take a log dosage response, so that we can plot all the dosages which is possible there. Okay, for example, if we go on using the dosage from like in arithmetic progression 2468, we will not able to plot it in a single graph. Okay, so we need to make an alternate way by which we can raise the dosage like in two decimal points from 5 milligram to 500 milligram. Okay, so such responses which involves a larger variation in the dosage can be better plotted in a log dose response curve. Okay, where it allows us to plot when we increase the dosage in a two decimal places also. Okay. So dose response curve is a valuable tool in understanding the levels at which the substances begin to exert adverse effects and harm also. So what is dose? So it's the amount of substance administered at one time. Dosage is the amount per unit weight of the exposed individual. Okay, so we actually determine based on the minimum dosage what we can administer. Okay, so first we will think, okay, so minutest form, like if we know that 1 milligram can be given to the mice, we will take 1/100th of it or 1,000th of that dosage and start our experiments. Okay, whether it can express the effects at that dose also, we'll start trying from that dosage. So we want to save the mice also here in this case. That's why we also first try it at a very 1,000th the dosage or 100th the dosage, so that the mice will also, in the mice we also study the pharmacological characters, pharmacokinetic or pharmacodynamic characters, and see that whether it is toxic to the kidney, whether it is toxic to the heart. All these things we'll study at very low dosage forms. Okay. So Exposure is characterized by number of doses, frequency, how frequently we are giving, and total period for which we are giving the drug. Okay, so we have this two types of methods by understanding this dose response curve. The first most commonly used form is the graded dose response curve. Okay, it's a continuous scale. I'll be showing the diagram and explaining to you. Okay, so quantal response is either of any like in quantal dose response curve, whether the drug can elicit the response or cannot elicit the response. For example, we started with paracetamol. Okay, so in graded response curve, what we will be doing is we will be giving the same paracetamol at dosage of starting from 5 milligram, 10 milligram, 15 milligram, 50 milligram, up to 500 milligram. We will be slowly increasing the dosage. That's what is mean by graded dose response curve. Okay, here in graded dose response curve, we can compare one or two drugs. Okay, so we are actually finding the maximum efficacy at which the response is seen. For example, we see that in graded response curve, at 500 milligram, we are able to reduce the fever to the maximum. Beyond 500 milligram, the decrease in the fever is not that much different from what we give at 500 milligram. That means like at 500 milligram also the drug is able to decrease the fever. At 1000 milligram also the drug is able to decrease the fever, but there is no difference in the efficacy there. That means it has reached its maximum capacity. That will show you graded dose response curve. In case of quantal dose response curve, we are actually comparing different drugs. For example, it may we are comparing diclofenac, aceclofenac, other sulindac. There are so many other drugs which can decrease the fever also. Okay, so there we are actually putting the temperature bar, like it should reduce the fever by 1 degree centigrade. And when we are using these so many drugs and we are keeping a standard, the drug should be able to reduce the fever by 1 degree centigrade. So if the drug is not able to do it at varied dosages, here in quantal dose response curve, we are not worried about how much of the dose we are giving. It may be 5 milligram or 5000 milligram. Okay, the drug should decrease the fever. That is the criteria. If the drug is not able to decrease the fever by 1 degree centigrade, we tell that the drug is not potent. Even if we use 5 milligram or 10 milligram, the drug is able to decrease the fever, then we put it as the drug is potent and it solves the criteria of the quantal dose response curve. In case of graded dose response curve, that is not the criteria. Okay, so there it is slowly increased the drug dosage and we are trying the response there. Okay, what these two responses or these two type graphs are doing. Okay, so they relate dose and frequency of response in a population of individuals. Okay, so they are relating the dose and frequency, often derived from frequency distribution of doses required to produce specific effect. Okay. So potency refers to the amount of the drug that is necessary to produce a certain effect. Okay, so potency I told you here it should be able to reduce the fever by 1 degree centigrade. That will be the potency. A drug which produces certain effect at 5 mg is 10 times more potent than a drug which produces the same effect at 50 mg. So naturally we will choose a drug which is 5 mg, okay, rather than 50 mg drug. Then clinical efficacy. Okay, so clinical efficacy refers to maximum clinical response that can be obtained by a particular drug. For example, we told with the paracetamol 5 milligram or 500 milligram. Here the example given is maximum clinical response that can be obtained in a particular drug. Okay. So clinical efficacy refers to the maximum clinical response that can be obtained. Then we have the other points, that is ED100 or ED max, that is the ceiling effect, the concentration at which we get a maximum response. We told that paracetamol at 500 milligram may be producing the same effect as paracetamol, which is producing at 1000 milligram. Okay, so there is no difference in the response. That means the tissue has reached the ceiling effect beyond which the rise in the drug concentration will not have any change in the response. So coming to potency. So relative position of the dose effect curve. Okay, relative position of the dose effect curve along the dose axis. Okay, so has little clinical significance for a given therapeutic effect. A more potent of two drug is not clinically superior. For example, here we have to take an example and understand a more potent of two drug is not clinically superior because, for example, we take paracetamol. Okay, so paracetamol 500 milligram tablet will cost you 1 rupee. Okay, whereas newer drug, it may be the example I'll give indomethacin. Okay, so the new company has come with a drug indomethacin. It is producing the same effect of paracetamol at 50 milligram, but it also means that at 50 milligram, if the cost is 5 rupees, now the person will only go for paracetamol 500 milligram tablet, which will cost 1 rupee. Okay, so that's what we mean by a more potent of the two drug is not clinically superior. Okay, so maybe the drug is effective, but we should also see the cost of the product. Okay, low potency is disadvantage only if the dose is so large that it is afford to administer. For example, here the difference is the newer drug indomethacin with 50 milligram we may be more potent, but we are not worried because 500 milligram paracetamol tablet is also very small and it can be easily taken. Okay, only if it is awkward to administer, then only we will be able to stop the drug and use a more potent drug. Okay, so because here cost is an important factor, we need to understand both cost also and pill size also. So here this diagram is a very beautiful example how the analgesic effect works. Okay, so here we can see that morphine or hydromorphone are highly efficacious drug to produce analgesia. Analgesia means decreasing the pain. And we can see that the dose of hydromorphone or the morphine is about 5 milligram here. And aspirin for analgesic effect we need it at 6000 to 5000 milligrams. So here it is offered to administer because for, aspirin 300 milligram tablet is about a small pill size, and we have to take aspirin at the dose of 5000 milligram means it becomes awkward. That's why aspirin is not used for analgesia nowadays. Okay, aspirin is presently used for antiplatelet activity, and for analgesia we are not using aspirin. Okay, so morphine is better choice for analgesia. So here one more slide is there, which is very important part. Usually this experiment all the student used to do in your senior batches like 3-4 years back. All of them tried this experiments. Here it is an experiment showing concentration of acetylcholine. ACH stands for acetylcholine, my isolated small intestine. Okay, so small intestine of rabbit, we are showing this effect. Okay, so what is that we are showing? Graded response curve. Why graded dose response curve? Here you can see that it is 0.5 milligram, 1 milligram, 2 milligram. Okay, so here we are raising the concentration in geometric progression, and the responses is also increasing. And here we can see that as the responses are increasing at higher dosages, it is very difficult to plot this on a graph. Okay, so in order to plot this, we use a log dose response curve. Okay, I'll be showing that is a sigmoid shaped curve. So what we saw now is a graded dose response curve. So how we are plotting it? Okay, when we are using different doses of drug, concentration and contraction and relaxation of the muscle takes place. That's what you saw there. Okay, when the drug concentration is more going on increasing, the contraction is also going on increasing. Such experiments can also be done with the intact animal or the isolated tissue. Here it was the isolated tissue. So in intact animal, we can measure the rise in the blood pressure, rise in the blood sugar. All these things can be done. Okay, so studied in vitro on a piece of small intestine in this axis. Okay, so we have x-axis and y-axis as a response. X-axis for dose and y-axis for response. So arithmetic scale, it can be increased. Now in this diagram, what we shown just there, we used a geometric progression. The dose increased or doubled in the next cycle. So here to plot that, we are using a log scale. Okay, so I'll be showing you. So here the response, you can see that dosage, if we are putting this, okay, so if we are not taking log 10, 20 milligram, that the graph will be very big one. Okay, but here we have shown it as a small graph, but the graph and the response, that will be huge one. So what we do is we use a log dose response curve. So we put log for the dosages which we have used, and the response remains same. So there we get a sigmoid space of shaped curve. It is easy to plot and easy to measure. Okay, so dose response curve here, the cumulative curve is used to show the data. So y-axis is showing the responses, x-axis is raising the dosages. Okay, so ceiling effect. Okay, after some effect, for example, after some dosages, here the ceiling effect, as we can see, is about at 15 milligram. Until 25 milligram, the response has not that much increased. Okay, so that's what we mean by ceiling effect. So the muscle has reached its maximum power of contraction. Beyond that, it cannot contract. That is ceiling effect. Now with this concept, we can actually find out the other associate concepts, very important to understand. Okay, so that is about the therapeutic index. Okay, what is this therapeutic index? So therapeutic index is very important to be known before administering a drug. That means a drug with narrow therapeutic index means the drug should be used very carefully. The drug with wide therapeutic index means the drug, if at all taken, one dose is missed or double dose is taken, it will not harm the person. Okay, so we should be very careful by using the drug with narrow therapeutic index. So example here given is digoxin and warfarin. Okay, so they have very narrow therapeutic index, and therapeutic index with wide margin we have given it as penicillins. Okay, so penicillin, for example, we can be using that 40 milligram per kg body weight. In some cases, they will be using that up to 100 milligram per kg body weight. Okay, so it has wide therapeutic margins. Whereas in case of digoxin, the drug dosage is about 0.5 milligram, and we cannot use it little bit more also, little bit less also. So that will be the difference between the each drug. So what is this therapeutic index? It is LD50 upon ED50. What is LD50? Lethal dose. That is dose at which 50% of the population dies. ED50 is dose at which 50% of the population shows response. Okay, so with this margin, we have to use the drugs. So here we are showing the margin of safety. Okay, so here this will be the margin of danger. Okay, so analgesic effect, here respiratory effect. So here with morphine, we have one adverse effect, that is respiratory depression. And respiratory depression goes on increasing as we increase the dose of morphine. But here the morphine analgesic effect is needed. Okay, so we have to take the effect of analgesia without affecting the respiration. Okay, that means when we use this morphine at lower dosages, the respiratory depression is less, but the analgesic effect is also obtained. That's what we mean by margin of safety in this diagram. So what is the advantage of this semi-log dose response curve? The effect is not under log. Okay, that's why it becomes semi-log. Only the dose is under log. That's why it is semi-log. So wide range of drug dosages can be depicted. That is 1, 10, 100 like that. Okay, otherwise if it is a small graph, log is not taken, we'll be able to plot 1 to 10 or 1 to 20 at the max. We cannot plot 100 here. So that's why the x-axis or the dosages are under log. So wide range of drug doses are depicted. Easy comparison, okay, easy study of antagonist. So the middle portion which appears as a straight line will be easy to compare. Okay, the first by 25%, which is the slow rise, or the last 25%, the slow going to the ceiling effect, that will plot to us. So coming to the next part, that is quantum dose response curve, or otherwise called as all or none phenomena. Why we call it as all or none phenomena is because if the drug is producing the response or not. For example, here analgesic, whether it can decrease the pain or not decrease the pain, whether it can decrease the convulsions or not decrease the convulsions. That is simple criteria we are being taking. Okay. Okay. So now the drug dose of the drug evokes a fixed pharmacological responses, okay, studied in whole animal, that is in vivo or in vitro. So the results can be plotted as a log dose percentage curves. It is also called as the Gaussian distribution curve. Okay, so it's a sigmoid curve in case of this graded dose. Here we are getting a Gaussian curve. So obtained by keeping log doses on a horizontal axis and percentage of responses on a vertical axis. So what is that we are doing here in base of this? It's a bell-shaped curve. Remember, quantum dose response curve is a bell-shaped curve. Why it is bell-shaped? Okay, so what we are getting here, we can see that the center point at which we are getting the response. Okay, so there may be different drugs. For example, here the blocks what we are seeing may be the different drugs which are giving the response. And these different drugs are giving the responses at different dosages. Okay, so here in the bell-shaped curve, we have the different blocks. Okay, all these different blocks are giving different, are responding to, are showing different drugs, and these drugs are showing responses at various dosages. For example, in the x-axis, we are actually showing the different dosages. Okay, so one drug A, is able to produce the response. Okay, and it is about at the 1 milligram or 2 milligram, and we have the drug 9 which is able to show the response, that is the maximum response of 40 units, okay, at a dose of 9. And there is one more drug at 15 which is showing the response, minimal response. Okay, that here the criteria is it should be able to show the response. Okay, and ideally we will take which drug, we choose between 7 to 9 which are showing maximum responses. That will be the different part. Okay, so the following valuable data can be drawn. So medium effective dose, the dose of the drug required to produce 50% of maximum response. Okay, then the medium toxic dose, that means it will be able to kill the persons beyond that at least in 50%. Medium lethal dose, that is dose of the drug required to kill 50% of the experimental animals. So these are all the things which can derive from this quantum dose response curves. For example, one thing we are giving. Okay, so approximate oral lethal dose values of variety of drugs. For ethanol, if the drug is about, for example, 60 kgs man is there. Okay, so the person will be needing 13,600 milligram into 60 amount of ethanol to produce a toxic effect or to kill the person. Whereas digoxin, it needs 24 into 60 milligram to kill the person. As simple as it. Okay, so ethanol is having high therapeutic index, and digoxin is having low therapeutic index. So we have another terms which are very important for clinical trial purpose, that is no observed adverse effect levels and no observed adverse effect levels. So what are these terms? These are the terms which determine at what dosages we should start the animal experiment. Okay, so these are the dosages at which we are starting the animal experiments. Okay, so we have to start animal experiments. No, we should see that we should not kill the animal. Okay, so that's why we are starting the animal experiment at these dosages. Highest data point at which there was not an observed toxic effect, and lowest data point at which there was an observed toxic effect. So between these things, we'll start our experiments, or we will same plot the same thing on humans and take so much milligram of drug should not produce any adverse effects. So we can start the human experiments at these dosages. So this is how the experiments on humans and animals is carried out. So what are the uses of these dose response curves? Okay, the first thing what we are identifying is identify the therapeutic dose or the concentration. Define the site of drug action. Classify the effect produced by drug receptor interaction, agonist and antagonist. Okay, so how the drug is able to produce the response. So we are identifying therapeutic index. We are identifying the potency. We are identifying the efficacy. All these things can be done with our simple experiments. So and sometimes it will be helping us to find out the mechanism of drug interactions also. So these things can be derived, that is ED50, LD50. Just now we have learned all these things. No? So all these things can be derived with the help of dose response curve. So in the exams we can get a short notes or this. What are the uses of dose response curve? Okay, all these things should be mentioned. To finish it, all substances are poisons. Okay, by studying this today's topic, we know that there is none which is not a poison, and right dose differentiate poison from remedy. For example, atropine can be given at very low dosages. It can be helpful in treating the organophosphorus poisoning. But if the dose increases, the same atropine will become life-threatening to the people. Hope all of you got the understanding. If you have any doubts, you can post me. So thank you for joining.